Happy weekend, everyone. I am coming back with the purpose, intention of answering more of the discussion forum questions. And there was an interesting question, and it is, I'm interested in learning about the practices that resonated most with you during your early school years. Whether or not you have a diagnosed mental illness, I'm curious to understand which approaches were most effective and impactful for individuals. Well, that's a very good question. In psychology, there are some primary forms of intervention, like therapeutic approaches, that we know to be most effective. And for the most part, they include cognitive behavioral therapies. There's a new extension or a new type of cognitive behavioral therapy called dialectic behavior therapy. And then we know that for trauma, there's a method of therapy called EMDR that is very effective for trauma. And so in this post, I'm going to give you some links and some information about those modes of therapy. So basically, cognitive behavioral therapy is learning to be aware of your internal dialogue. Like, what are you thinking? What are you saying to yourself inside of your own mind? It's important to understand that not everything that you're thinking is true. Sometimes we are thinking thoughts that are coming from a place of anxiety or depression, and they're not actually true thoughts. Sometimes our mind can play tricks on us. And so, helping people to understand the difference between rational and irrational thoughts is part of cognitive behavioral therapy. And one of the most important things is for people to learn how to separate their thinking from their own identity. So learning how to think about thoughts as something like out there, something we can look at and talk about and analyze without it being connected to a sense of who we are as individuals. And that can be hard for children because that's a kind of abstract thinking. So what we often do with children is that we get them to name their anxiety or depression. So like their anxiety dragon or storm or monster or something like that, and then find a way of sort of distinguishing it from the child themselves. Dialectic behavior therapy, interesting because it adds a couple of additional components. The first is around mindfulness, being aware of what you're thinking. And the second is distress tolerance. So, sorry, allowing an emotion to come, experience that emotion, honor that emotion, but allow it to go. So, similar to like a wave of the ocean coming and then going, we can have emotion, we can honor that emotion, but we don't have to do anything when we're having that emotion. So we don't need to quit school or break up with someone, or, we can learn how to tolerate moments of distress. So the emotion comes, we honor it, we acknowledge it, but then we let it go. My next children's book is called Feelings Come and Go, based around that particular concept. Now, EMDR is a kind of therapy that we use specifically for trauma. And at a very sort of like simple level, it's about distracting part of the brain to allow the analytical part of the brain to access traumatic memories, process traumatic memories, and sort of put them away. So trauma acts in the brain a little bit like if you want to think of like a ping pong machine. I don't know if I'm saying that right, but where you'd like click those old machines and the balls would run around before they would drop into their spots at old-fashioned arcades. Well, trauma is so outside of the norm of human experience that memory, that image, just sort of bumps around inside of your mind, not knowing where to go, like not finding its slot to like be put. And so what happens is that the brain tries to process that image, that memory, and that can look like intrusive thoughts, flashbacks, nightmares. And for children, we often see it in what we call traumatic play, where they repeat the trauma in their play over and over again. So different types of EMDR help to kind of access that um, uh, traumatic memory and process it in a way that allows it to go into that ping pong hole so that the brain doesn't have to continue to process it itself. So we know that to be one of the most effective methods of treating trauma. Now, finally, we also know that when it comes to most of children's behaviors, there's a component of regulation and dysregulation, which means that children will have big, huge feelings come over them, and they don't have the skills. They don't know how to deal with those feelings. And so they don't know, how to take deep breaths. They don't know how to give themselves space. They just are in that intense emotion and they become dysregulated. So we know that helping children, first and foremost, to be aware of how they're feeling, be able to name what they're feeling, and learn how to utilize a strategy in the moment to allow them to get some control over their emotion, allows them to better regulate their emotion and then better regulate their behavior. Now, I love Dan Siegel, his work, The Whole Brain Child. He has a concept called the 4S's of parenting around this idea of how to help children when they're dysregulated. And it can be basically summarized into two thoughts, and that is see and soothe. So when we see a child is dysregulated, the very first thing that we do is we acknowledge them. Like, I can see you're having a hard time. I can see how frustrating it must have been to break that crayon right when you were coloring your paper. If I was coloring my paper and my crayon broke, I would feel frustrated too. So this idea about seeing, identifying, and validating the emotional experience of children. And then we would go into soothe. Okay, that's when we would maybe take our deep breaths, or distract the child, or turn the energy all around by turning on ABBA and dancing around the kitchen, or something like that. But we first see, acknowledge, validate the emotional experience before we try to change the emotional experience. There's been a great deal of information and research around the importance of first validating the emotional experience of the child. So those are really important concepts. I think those would be considered foundational concepts. They're concepts that we use in Mind Key Health. They're part of how we train our counselors. But I think the basic concepts there can be used by all people that work with other people, like all helping professionals, right? And I think we can summarize things into like this sort of like idea. Number one, that the thoughts that you have aren't necessarily true. Okay. So just because you're having a thought doesn't make it a true thought. Okay. Number two, emotions come and then they go. And learning how to allow an emotion to come and crest like a wave and then go is an important skill, because then we're not, controlled by our emotions. We're allowing our emotions to happen, but we remain in control of them. So we develop a sense of regulation over that emotion. And third, that it's important when a child is dysregulated, the very first thing you want to do is see them, and validate their emotional experience. That will go a long way towards helping the child then learn regulatory strategies. One of my favorite regulatory strategies, it is called the 3Bs, and it stands for, okay, be quiet, back away, breathe. Okay, so the idea here is before there's a temper tantrum, or before there's an explosion, or before there's conflict, like right at that very beginning moment when you see it about to happen, okay, you remember your 3Bs. You just stop talking, okay? You back away, you give yourself a little bit of time. Sometimes that might mean going to get a drink of water, going to get a cup of coffee, and you breathe. You breathe slowly, deeply. You hold in between the breathing and the exhaling. Okay, so box breathing. I think we've talked about it before, but it goes like this. Breathe in until there's nothing left in your lungs. Hold. Exhale even more slowly than you breathed in. Hold. So learning how to box breathe and teaching children how to box breathe can really bring the tension down, the emotions down, and learning that strategy can be really, really helpful. So that's a quick little YouTube video around interventions. I think they're good interventions. They're interventions which work. And I will include with this video a few little of my favorite resources. Okay, I hope that was helpful and of use. And I'll continue to make my way through the different questions that you have. Okay, happy weekend.